Okay, so this lecture is going to look at kind of the complete picture of the antipsychotic drugs. You may recognize bits and pieces from this lecture. It was cut previously to accommodate certain drugs that were covered in previous cases. Today we're going to talk about all the antipsychotic drugs together under the diagnosis of schizophrenia. So learning objectives are here. And just kind of a brief overview of schizophrenia. It's really a combination of Greek and Latin roots, meaning to split the mind. And we can see both positive and negative symptoms. And within that division, we can see hallucinations, delusions, and a disorganized speech. And I really like this painting that is done by a patient suffering from schizophrenia. And they're calling it a self-portrait. And this is kind of their perception of reality. Notice that they think they're being controlled by some type of a machine, and you can see the physical representation of that shown in this artwork. And so it's really kind of a sad disorder where it really affects these patients quite strongly. And you can see schizophrenia depicted in popular culture. Here's A Beautiful Mind, starring Russell Crowe, and then of course the story of John Nass, the American mathematician, whose story that movie was based on. So there's definitely a role for dopamine in the pathophysiology of schizophrenia, and that's based on a pharmacocentric hypothesis. Remember, I talked about the ability of these drugs to basically suggest the pathophysiology based on what we observe their effects are in the brain. And so the clinical data suggests that the drugs that are effective for psychosis just happen to be dopamine antagonists. And so when we use dopamine agonists in other diseases, we produce psychiatric behavior. Okay, and the great example of that is the dopamine replacement component to Parkinson's disease. And so as we kind of progress through that disease and the doses of dopamine agonists increase, we saw more and more psychotic behavior in dopamine treated patients. Excuse me. And so this nicely summarizes some of the pathways and kind of where some of these behaviors manifest themselves and kind of tied to the appropriate neurotransmitter. And so there are biological causes for the positive and the negative symptoms, and that kind of alludes to what's known as the hypofrontality hypothesis of schizophrenia. Basically saying that the negative symptoms are thought to come from a reduction in the activity of the prefrontal cortex, and it's suspected that these patients have an underdeveloped hippocampal region. And then in contrast, the positive symptoms stem from what we think are reduced inhibition of the more active nucleus accumbens, which basically allows for more activity. All of these drugs we've talked about in the context of other diseases, which is why you may recognize some of them individually. Many of these antipsychotics have utility in treating bipolar disorder, severe depression, coupled with anxiety, OCD, Tourette syndrome, and for a long time they've been used off-label as sedative agents. They've been used to treat insomnia, and they've been used to treat agitation as well. And I know I've talked about this before, but just kind of an interesting factoid. The first clinical studies at looking at some of the efficacy of these agents was the creation of the first double-blind clinical trial, which I think is really interesting. And so here's kind of a nice summary of the symptoms of schizophrenia. These are positive and negative symptoms. Of course, the positive symptoms we associate with kind of odd or bizarre behavior, excuse me, non-coherent thinking, hallucinations, and delusions. And these positive symptoms are more often best treated with the first-generation drugs, or the first-generation antipsychotics. In contrast, the negative symptoms, these are a bit more difficult to manage. These patients exhibit withdrawn social behaviors, poor speech. They can sometimes show a blunted affect, and sometimes they also demonstrate socially inappropriate behaviors. These symptoms are more often treated with second-generation drugs, although not as well. There's a third axis to schizophrenia, and that's the cognitive impairments, and we don't really have any drugs that treat that all that well. Now, there is one drug in particular called clozapine, and we'll discuss it in more detail shortly. This drug is really probably the most efficacious at treating the problematic negative symptoms, and so I want you to remember that. So let's kind of just briefly introduce the drugs that are used to treat psychosis or schizophrenia. And remember, we can subdivide them into first and second generation. And within the first generation, sometimes we can call these drugs typical antipsychotics. These are the first ones that were there. And so these were the typical agents. And the prototype is chlorpromazine. And there are derivatives of chlorpromazine listed there. The other one that you should be really familiar with is haloperidol. This drug has also been used for a long time. Emergency room physicians will affectionately refer to haloperidol as vitamin H because patients that are suffering from acute psychotic episodes can be kind of controlled very quickly with a little shot of haloperidol or vitamin H. And then other drugs of importance are listed there. And so these are your first generation or your typical agents. Those two distinctions are used interchangeably. You should probably know both distinctions. The second generation agents, which we've already talked about, are your atypical antipsychotics. And I will elaborate on some of the mechanisms as to what makes them typical versus atypical. But if you look at the brand name drugs, which are listed in parentheses, I'm sure you'll probably recognize some of them. Zyprexa, Abilify. A lot of these drugs have very popular prescribing commercials and HR type things on the television and radio. So that's our introduction for antipsychotic medications. We'll continue now with first generation typicals in the next lecture.